Welcome back, everyone, to another episode of the Virtual Cafe Summer Series. Cheers.
Cheers.
Joined by Caitlin again today for her second talk, which we're looking at when dizziness is not just dizziness. So I'm quite excited about this one because it's get to nerd out again a little bit more with Caitlin, which we love doing, don't we, Caitlin?
Absolutely. We promise this time it won't go for as long.
Well, I was going to say it's going to be a hard promise to keep, but let's try and stick to it.
Right, we'll try.
So I was going to say, hopefully everyone grabs a cuppa and gets to sit down and relax with us as we talk about dizziness. So I think we need to probably start by giving a bit of an overview of the vestibular system. I might bring up a picture of it.
Let's have we'll start sort of from the outside going in. So our vestibular system has an awareness of where our head is essentially in space and time. And it detects how movements happen. But everyone thinks it's just the ear, but it's not just the ear. And the picture that Simone's just put up for you there gives a little bit more of an information about where the vestibular apparatus sits. So if we go from the outside in, we've got the ear, then we've got the auditory canal, then you're coming through essentially into your membrane that sits in the ear. And then we come into the vestibular apparatus. So the vestibular apparatus, it looks like a snail. It's probably the easiest way to describe it.
And it controls all the dizziness, right? I think we probably just need to flag that to start with. So for anyone who's experiencing dizziness, I shouldn't say all the dizziness, but it's one of the main things that can cause issues with dizziness for people.
It is. There's a couple of different factors that we'll talk through that can contribute to dizziness, but for most people, when they do experience some dizziness, it can be from the vestibular apparatus. And if you do have vestibular symptoms or dizziness style symptoms, your healthcare professional should be having a look at this apparatus as well as the other things. But we'll go into that a little bit more later. So when we have a look at the vestibular apparatus, before we change over to the other one, we've got the cochlea, we've then actually got the semicircular canals, which are really, really important with regards to motion and movement. But I also want to bring your attention to, we've got two really key nerves that supply the vestibular apparatus. So you've got the vestibular nerve and the cochlear nerve through there. And sometimes when we have problems with these nerves, we can actually then get dizziness symptoms as well. So I just wanted to point those out because the next picture we're going to show you doesn't actually show those nerves and the supply through there.
So I'll show you that now.
Yeah, so this is a little bit more of the inner workings of your vestibular apparatus. And it looks like a lot, but we're going to keep it really, really simple today. So we've got our semicircular canals, which are these three tube-like formations that you can see. I think Simone will probably maybe point them out. There we go. And that's filled with a fluid that helps give us awareness of how we move, because when we move our heads side to side or rotationally, the fluid in these canals move. And what it then does is, if you see down on the lower left-hand side, we've got these hair bundles and then we've got this cupula. And that, when we move our head side to side, that actually gets moved because of the fluid. What then happens through there is we get feedback from this vestibular apparatus of, I'm now moving to the left. I'm now moving to the right. And the rest of our vestibular system can aid in controlling that movement through there. The other thing I just want to point out that we will talk a little bit about is the otoconia, which commonly everyone will refer to as their crystals. So people often say, my crystals are a little bit out. What can happen in some vestibular conditions, which we will talk about, that do give this feeling of dizziness, is that some of these crystals can break away. They can then be free flowing within the fluid and then have disruption against the hair, which then gives this really big sensation of dizziness. So as much as we talk about the fluid moving, this is another component that can create some dizziness type symptoms.
So this little picture here on the bottom right, that's kind of like a zoomed in version of this, isn't it?
Yes.
Yeah. Yep. So people can sort of guess, get the gist of, we've got the big snail in the snail, we've got the small little canals. In the canals, we've got the cupula and the hair bundles, and then this is a zoomed up version with the otoconia, which is the crystals. So we're going to just refer to them as crystals from now on.
It's much easier just to call them the crystals.
So much easier, right? And so I want to bring up a third picture that I think is a really nice little way of kind of explaining what you said before.
Absolutely. So it just shows about how when we're stationary, we don't have a lot of movement going on through there. But then when we start rotating, we actually then get movement within that cupula and those hair cells, which then provides feedback of we're moving. We then need to compensate and accommodate for that movement through there. So this actually leads really, really well into the vestibular apparatus is one component of our vestibular system. The other component of the vestibular system is our vision.
Yeah.
So, and our proprioception, which is proprioception is a term that we use for our body's awareness of where it is in space and time through there. So they're sort of the key factors that we will be referring to as part of looking into dizziness today, and why dizziness is not always just dizziness.
Yeah, right. And so when the hair cells are moving, when the otoconia, where the crystals are moving, they're basically sending messages to the brain. The brain is taking those signals and then mixing those signals, incorporating it with the signals that we're getting from our proprioception system, as well as the visual system, and integrating it together. And then it's giving us feedback of where we actually are.
Simply, yes.
That's okay. That is the simple way of explaining it without spending about 5 hours going into a really in-depth vestibular anatomy. Yeah, good. I like that. We'll keep things simple today. Okay. All right. Well, thanks for giving us that overview. I think that's important to sort of understand the basis of in terms of vestibular system. So let's go actually into, like, I guess, simpler terms. Let's talk about dizziness. Talk to me about, I guess, the difference between a few different types of dizziness out there, because you can feel dizzy when you stand up versus, like, you can feel like the room is spinning. Talk to me about those.
So it's a really interesting descriptive term, because dizziness is something that everyone has they will use the term to mean different things. So it's really important when you do get dizzy that you might find, if you're seeing a health professional, they will ask, what is your dizziness like? Is it that you move and you suddenly get the sensation that the room is spinning? Is it that you move and you feel like you are spinning, or you feel like you can't focus on what's in front of you? Or another really common symptom that some people will describe their dizziness is going, I feel really drunk when I'm walking. And we all know that sensation is a couple of drinks, or we go to get up in the morning and we're like, oh. That's a sensation that some people will describe, and that's linked to another form of dizziness that people can actually get. There's also a lightheadedness. So often some people will describe a sensation of dizziness as being lightheaded, or the term vertigo. So vertigo is quite a broad-based term. And when you have a look at, there's actually specific criteria for how you talk about dizziness, and vertigo tends to be more the sensation of the room is spinning.
Yeah.
With it. So yeah, there's heaps of different parts that come into play. So when someone's talking about dizziness, it may not be the same way that you feel dizziness is. And that's okay, because it's really when it comes down to a health professional that they are the ones going, all right, this is the type of dizziness that you actually have, to put a name on it.
Yeah, I was going to say those terms are really great in terms of descriptive terms from a patient point of view. It helps us as healthcare professionals actually determine what's underlying the key driver of your dizziness. So let's bring it back to pole for a second. If we're talking about someone spinning around the pole and then they feel dizzy as soon as they stop, what sort of type of dizziness is that?
So there's a couple of different ones into play. So some people, that may be emotion sensitivity. So they're actually, and they will be these people that often will describe sometimes motion sensitivity when they're in a car, or when they're on a plane, or they're in a playground and they don't like going on the spinning. I can't even remember what they're called.
Spinning circle things that you just get run around. Yeah.
I love kids have got off and, went to go stumble, or if anyone's played the broom game, that sensation that you get from that.
Yes.
That can be a form of motion sensitivity. So for some people, that is a specific condition where they are sensitive to movement. For some people, they're not actually conditioned to doing the movement on a spin pole. So their bodies haven't quite adapted to that movement pattern. It's like when you first do the splits the first time, not a lot of people can go straight into the splits because your body isn't conditioned to go into it. So often when people first start in a beginner's spin class or they're learning spin at pole, they can get that sensation because their body's not used to that movement.
So they're sensitive to spin. That's one thing, or they're sensitive to the speed of the spin.
Correct.
Yeah, or the amount of the spin.
So the amount of the spin. Yep.
Yeah, as I say, there's probably a few different factors there.
Yep.
All right, and so there's heaps. Like the world of dizziness is quite broad, so we won't go into all the different things. But I know that there are some really important key differential diagnoses that come into play, particularly when it comes around pole dancers and the aerialists. Can you light on these? Yeah.
Absolutely, because this is really quite fascinating from this aspect of it. So we spoke earlier about having the 3 different canals. So there's an anterior, so meaning at the front, posterior at the back, and horizontal, which means it's horizontal.
Yeah.
The most common form of dizziness that we see in the general population is the vertigo, so otherwise known as BPPV. And I'm not going to say the word in full because I always struggle to pronounce it correctly, but everyone should know what BPPV is. Essentially, my crystals are out with it. The most common in the population is the right ear and the posterior canal. In pole dancers, because of the positions we go into, we can actually see some patients with BPPV in the anterior canal because of how we move our heads when we're upside down. So that's a really niche area to pole circus aerialists that can be quite fascinating when people come in, and the tests that a clinician will do to confirm which canal it is a little bit different when it's the anterior canal. So that's a really common one. Another really common one is what we call cervicogenic dizziness. So dizziness that gets referred, or that can be a symptom associated with your neck. Yeah. And again, that's a whole nother topic of discussion on how our neck can refer dizziness symptoms, but that's another component that we are really, really aware of with polers as well, going, is it something with how they're actually doing the particular trick? Is it how they're holding their head in position? Is it that lack of control going through there? We've spoken about the motion sensitivity. Another one that is one that we were often questioned about to rule out is what we call a vestibular neuritis. And neuritis just often refers to inflammation of the nerve. So if we're back to the first slides of the show where there was the vestibular nerve and the cochlear nerve, inflammation to that nerve, now whether that's a viral inflammation or another form of inflammation, will actually result in some dizziness symptoms as well. But they have a very specific description, and that's often that drunk sensation. They'll get out of bed, they feel really drunk, and they feel like they're on a boat with it. So there are a couple of the common ones that I see. And concussion, I should also add in to there. Concussion can result in dizziness symptoms.
Yeah, I was going to say with the vestibular neuritis, that's the people who post-COVID potentially had a viral infection of their vestibular nerve and then maybe experiencing the dizziness, for example. That might have been one of the reasons. Not going to blanket rule that one for everyone, but that might have been one of the things.
It is really quite common for people who have had a virus and often a week or two later suddenly present with this symptom. So a healthcare professional will not just be asking, oh, how have you been feeling over the past couple of days? We'll often ask, what have things been like over the past month? Have you been generally unwell? Have they just been essentially running on empty for the past 4 weeks? And this is one of the symptoms that come up. But that's just something, as a broader perspective, as a healthcare professional, we would be asking questions to rule in and rule out why you're getting dizziness and where it's coming from.
And so I think that's probably really key to point out here is that someone who experiences BPPV, which is benign paroxysmal positional vertigo, there you go, I got it. So say,
not just me, it's not just
10 times really fast. No. So anyone who's experiencing that won't just get symptoms whilst they're pole dancing. They'll get symptoms away from pole dancing, and they probably won't turn up to pole dance class because of how symptomatic they are.
Absolutely. So with a lot of with BPPV, with your vestibular neuritis, your symptoms will come either with head movements or with positional movements. So a really common one with BPPV is getting out of bed of a morning, or I went to go put something in the dishwasher and I stood up and I suddenly had this sensation, or I was at the hairdresser's and when I moved out of the basin, these symptoms come on now every time I move my head in a specific direction. So often people with the acute onset of these symptoms, you will not see them at pole, because even trying to walk around a pole will probably feel absolutely rubbish.
Yeah, I was going to say, and it's not to be confused with triple PV, which I know we haven't chatted about. I won't get too much into it, but
correct.
This is where people do get confused, where they maybe would you kind of refer to that as that motion sensitivity? Like it's kind of comes under that banner a little bit. It's
comes under that banner a little bit with a bit more history.
Yes.
Around a little bit more history around it. They can be interchangeable, so you can have that with your motion sensitivity. But yeah, it's something that if you have it, your healthcare professional will be able to talk to you about it and give you strategies around it.
So triple PV or triple PD, depending on how you refer to it.
Yes.
It's persistent postural perceptive dizziness. So those with chronic dizziness. So this might be someone who is constantly like, oh, my crystals are out, which we'll chat about later. But they're not actually, it's not true BPPV. So there's lots of different causes of dizziness, and it's really important to actually get it diagnosed correctly, because treatment will differ greatly. That's probably the main thing I want to get across there.
That is the main thing, and that might be a really good opportunity just to talk about what treatment can involve, because a lot of what we're going to talk about later is a little bit more myth busting. But from a physio perspective, physios are actually trained to be able to assess aspects of dizziness. And there are a number of tests that we can run through to help differentially diagnose or identify where is that dizziness coming from. However, like all things with healthcare professionals, there are physios who are actually specialist trained with regards to vestibular symptoms. And as physios, if it's something that's a little bit left of center or something going, we may not be the right person to manage your dizziness symptoms, we will refer you on.
Yeah.
With it. And the same with the GP. If you have an acute onset of dizziness symptoms, your GP may send you straight away to a vestibular specialist. However, you may actually be able to see a physio to get some relief in your symptoms, especially if it's something with like BPPV, because there's specific treatment techniques that we can do that are really, really effective straight away.
Yeah.
To give you really, really good relief. Same with psychogenic dizziness.
Yeah, there's so much. I was going to say BPPV is kind of the scapegoat for dizziness. It's the one that a lot of the time patients might see their doctor, and they're aware of all the other different conditions, but they don't necessarily know how to assess and treat for the different ones. So they'll just send off to the physio and go, this person has BPPV, and it's quite clear on assessment that they don't. So it's really important that from a patient perspective, that as soon as you're experiencing any sort of onset of dizziness, is that you're straight to a healthcare professional, like a physiotherapist that's trained in vestibular treatment, not necessarily a vestibular specialist physio, but maybe a physio with a master's degree behind them, so have gone and done further study, someone like myself and Caitlin, who actually understand how to assess and treat the vestibular system with a little bit more nuance than maybe say a new graduate. Saying that, if you can only getting to see a new graduate physio and they are aware of the bare minimum, then that's going to potentially be better than nothing. So getting in to see someone as soon as you can is really helpful. And then if we as therapists we can recognize straight away where our scope of practice lies, and so there are definitely vestibular specialists out there for a reason, and they can be in the shape of a doctor or a physiotherapist. So if we need another physiotherapist on board, we're very quick to refer on to them, because they do have some very specialized equipment that can look at different things like your saccadic eye movements and whatnot. But that it gets very complicated, so we're not going to pretend to be vestibular specialist physiotherapists by any means. That's not us. As
part of my training with my masters, I actually asked to do a week's placement with one of the quite senior vestibular physios in Queensland, and my mind was completely blown And I came out with such a small fraction of what they know, going, okay, I now really know when to refer with it, which is great. And I think an important part that comes to that as well is if you do have dizziness symptoms and you are seeing someone, they should be having a look at your balance and your eye movements as well. Because like we mentioned in the beginning, it's not the vestibular apparatus is one component, which what makes up your vestibular system. So the assessment shouldn't be involving it all. I think another component to that as well is if you do have dizziness symptoms and you are feeling really, really, really unwell, you need to go see a health professional sooner rather than later. And that may be your GP, or if you've got any other symptoms, then you may actually need to present to a hospital, because there are some dizziness symptoms that we don't generally see in a sporting population, but we can, like, for example, a stroke can present with dizziness symptoms. So that's a really important caveat on it, that with, you know, if your gut feeling is telling you I'm really not well, follow that.
Yeah, spot on. I say to people that as soon as you have any nausea, associated vomiting, anything like that, you're straight to your GP first, or emergency department, depending on the severity of the symptoms, to actually ensure that there's nothing else more medical underlying other than a vestibular-based dysfunction. Yeah, that's probably the best way to explain it. Yeah, and look, a lot of the time, you know, your standard vestibular issues will cause nausea and potentially vomiting as well with it for those who experience some considerable symptoms. So seeing your doctor can be quite helpful from a medication point of view to at least stop that in the interim, so that you can have physiotherapy-based treatment.
Absolutely.
Okay, so let's bust some of these myths.
Oh, I'm excited about. I love the myth busts.
As I say, this is my Charlie's Angels myth buster. One sec, do it together.
Which way? Am I going this way? No, this way.
I'll go this way. Oh no, yeah, this way. Yeah. We're very mature physios. Absolutely. Okay, so first one has to be the myth about my crystals being out. So right.
I love this. I actually really like it as a descriptive term, because if patients have had BPP before, they will come in and go, Caitlin, my crystals are out.
Yeah, cool. They're like, put it back in.
And they're the ones that, if it has been true BPPV, they've had the correct treatment related to the correct canal that's effective, they will walk out of the clinic feeling heaps better than they walk straight in. And 90% of the time, they don't actually have to come back.
They're a wonderful patient to treat. I love treating a patient, because you literally go, done, better, tick. It's amazing.
So I think a really important thing is, if you find every time you go, you try spin, every time you're trying, even sometimes just a really quick head flick can give you the symptom of, or that sensation of dizziness. It may not actually be that your crystals are out. So just be really, really aware. If you're always trying spin pole and you're like, oh, it always makes my crystals feel like they're out, it may not actually be BPPV. And that's the time to go see a healthcare professional. And it's one of those situations where booking an appointment with the Pole Physio, they'll be able to run through a little bit more, ask some of the questions that we've been talking about, to really get down to, is it BPPV? Is it emotion sensitivity because you're not actually conditioned to doing spin pole? Or is it the 3PD? There are many different, and then there's a whole other category of other conditions that we could talk through as well. So I think it's really, really important that my crystals are out is a really layman's term that sort of encompasses everything dizziness wise, but not actually the best term to be using.
Yes. So if you're dizzy, it doesn't necessarily mean your crystals are out. It may apply for a certain population of the dizziness population, but it's not for everyone. And I want to go back to quickly the cervicogenic dizziness. It is so underappreciated how many patients actually experience cervicogenic related dizziness. I think that in my years treating, I've probably seen more cervicogenic related dizziness patients than a true BPPV patients.
Correct. And that's part of where I went and did this additional training, because I really wanted to know what else is there out there that we don't get specifically taught in our undergrad or our postgrads, because I'm seeing a lot of cervicogenic dizziness and I want to make sure that
you're not missing anything.
I'm not missing anything through there. So fully agree with you on that one. There are so many patients that will come in and you'll talk through their dizziness symptoms and you'll run through an assessment and you'll do a particular thing. They're like, oh, that's my dizziness. And you're like, let's do some work on this.
So I shouldn't laugh at this because it's not funny, but they're the ones that have been given the handout for the BPPV from their doctor, being like, oh, you've got dizziness here, do these exercises. And the exercises put the neck into extreme ranges of motion. And
it makes it worse.
It makes it worse because their neck is the thing that's causing the dizziness. So they're doing these really fast style movements. Anyway, it's not funny, but I just, yeah, I'm laughing from cringe. That's probably where it comes down to.
I think it's really, really good. And that's where we've spoken about how we've got physios who are quite specialized with regards to vestibular. And in the clinic that I'm at, we work really closely with a couple of them around town where they go, we're not feeling that this is actually primarily vestibular. Can you do some cervicogenic rehab and see if that's a trigger? And we're the same. We will see people manage it from a cervicogenic perspective, start doing some vestibular training, going, actually, you need to be assessed further in depth from a vestibular perspective because this isn't primarily cervicogenic. There's an element coming from it, but it's not the reason why you're getting all your dizziness symptoms, and refer that way. So I think it's really, really important with your symptoms. You may actually be seeing two healthcare professionals because there may be an aspect that you have to rehab from a cervicogenic perspective, but there may actually be a really advanced vestibular aspect that's outside of our scope that needs rehab as well.
It's all about collaborative care.
Correct.
Awesome. All right, so I want to chat about concussion as well. There's probably a few myths about those.
Oh, there are so many myths about concussion, but probably the biggest one that we see, and this is one the research is really pointing to more recently, is that I didn't lose consciousness, so it's not a concussion, or I didn't hit my head, so it can't be a concussion. So the concussion actually is associated with an acceleration, deceleration movement that doesn't actually need to have a direct impact. It's essentially the movement that occurs in the brain that causes an element of trauma through there that can result in a concussion.
It effectively is like a whiplash to the brain without any hit. So you could be in a car accident, have a whiplash and be concussed, even though you don't hit any objects either side of you. The other thing is you could fall to the ground, strike your side of your body, your head doesn't actually get hit, but your brain is doing a side-to-side rapid motion, acceleration, deceleration. Your brain is moving within the skull and is hitting the inside of the brain walls, the skull walls. Gosh, great English there. Skull walls. I need more coffee. But yeah, that contact is enough to cause concussive episode. And this is the one I'm quite passionate about concussions. So I could spend a whole nother coffee chat talking about concussions on their own. But there's certainly there's a spectrum of concussive symptoms, and you don't have to lose consciousness, and it can be all the way from mild through to severe in terms of dizziness. But a inappropriate and early return to pole can actually cause considerable long-term concern to the brain, but also prolonged symptoms, including dizziness, and that is a big one. And a inappropriate return to pole or an early return to pole when you're not fully rehabbed from your concussion can actually be quite detrimental from a musculoskeletal point of view as well. The amount of injury, there's a considerably higher injury risk post-concussion. I think you're 3-point-something times more likely to injure your knee or your shoulder or any other part of your body when you're returning back to concussion within 12 months. So for 12 months, you have an increased risk of injury. So anyway, there's a tidbit.
I was going to say as well, the evidence around that with some of the research I was reading is that females are more likely.
Yes.
As well. So
it's because of our neck strength. So this is where I find it really interesting, is because we have smaller necks generally. So assigned females at birth generally have smaller neck size. And so then our muscles are reduced in capacity compared to those who were assigned male at birth. So it's just really interesting, those little intricacies. So there's some research that's being done about strengthening neck muscles in professional athletes like rugby players who use a lot of their neck when they're going for scrums, so that the risk of concussion is higher. They actually do neck strengthening exercises with weights. So in the gym, they put like cables around the head. So I've got a physio mate who works with rugby, and they literally lift like 80 kilos with their skull doing like neck strengthening work, and they do the opposite backwards. So again, concussion, I could talk about it for ages.
And you've got a great blog on it that you put out about head injuries and pole. So I think if anyone's a little bit more interested around the concussion aspect of it, is have a read at that. From a physio perspective, this is a hot topic, especially with a lot of the rugby players that are passing away. They're allowing autopsies on their brain, which is where they're actually identifying one of the symptoms around, I think it's dementia, specifically CTE.
Yes.
And I'm trying to remember the acronyms, what that specifically stands for, but essentially it's not something you can assess for when someone's alive.
Yeah.
But it's something that they're now seeing. So it's something that we are really, really aware of. You have a look at a lot of professional sports over the past, I would say 10 years, most professional sports have a concussion policy, including a return to play, which they go by the book.
Yeah. So CTE is chronic traumatic encephalopathy, and they're looking for a certain protein in the brain, and it's thought to be caused by repeated blows to the head and repeated episodes of concussion. And it's really interesting if we look at other sports. So if we talk about football, in Australia we've got AFL, but in Europe and most of the rest of the world, soccer. Sorry for those who cringe when I say soccer, but football for you, we call it soccer in Australia. And concussion from repeated exposure to heading the ball is one of those things that they've actually looked into, because they've found that professional athletes who have in soccer may be more prone to CTE, and certainly in Australia, repeated concussions. AFL is an intense sport. I don't think I've seen a sport so heavy contact as some of the stuff that I've seen in AFL, but there's definitely more and more autopsies being performed. Again, I could talk about this forever, I won't, but the main takeaway from concussion is that it is definitely a cause of dizziness, and if treated inappropriately, if we don't care for our brain the way it should, it can be an ongoing cause of dizziness. And I would implore from my deepest of hearts that if you do have a fall from the pole, that you don't get back up on the pole, that you go straight to a healthcare professional, whether that's that day because you have emergency-based symptoms, or whether that's within 24 hours and you seek medical guidance, depending on what's happening. But I would implore that you get seen ASAP by a healthcare professional to rule in or rule out whether you have concussion or not. You are not the person that can actually determine whether you were concussed. You need someone else to assess you. So even if you think your symptoms are mild or you've got nothing going on, still get looked. And we should be doing our absolute most to be preventing falls in pole, and we should not be making fun of people who fall from pole. So that is the other thing, is because someone doesn't land on their head, any fall is still a fall that puts us at risk of concussion and can cause serious injury to the brain. So I'm not a big fan of seeing falls from poles being posted online. So just something to think about. If you think it's a bit funny, a bit of a giggle, it might be at the time because you might not have gotten injured. But if we keep on promoting this sort of culture of falls within the pole industry, then we're normalizing concussion over time and normalizing other injuries.
Emphasize the safety mats. We have them, use them. It doesn't mean you're less of a polar if you've got a safety mat. I mean, I used safety mats when I was first learning a Superman.
Yeah. Oh man, I
need something to land on with this. This is going to be uncomfortable.
I knew I was going to fall straight out of my Superman. I had to push myself into it. I was like, come on, you can do it. It was just the pain of the leg pain. I was like, everything else is fine. I just know I need to fall straight down, and I had to do that.
I want some safety there.
I need some safety. Yeah. So no, absolutely. And get a spotter. When first learning, always get spotted. Don't do things at home that you don't feel comfortable with. If you're a home polar, so I'm diverging on concussion, but if you're a home polar and you're learning literally just at home, use a partner, a friend to spot you, but be really mindful of checking your poles constantly. I believe per X-pole requirements, you're supposed to be checking your pole every 30 minutes. So check that there is no movement, that there is no give, because the amount of poles, even the good poles out there that I've seen fall down. I've seen in the last year, I've seen a professional pole dancer who checks their pole regularly, like literally every session, have one their pole fall down and sustain quite a serious injury. So please, for anyone who's polling at home, please make sure that you check your poles. Yeah. All right, I'm going to stop talking about concussion because
Concussion. That's a topic.
I hijacked your topic. I'm sorry.
No, not at all. If you didn't talk about it, I would have. So that's fine.
Yeah, I say we promised something at the start that we can't deliver on, can we?
I stick to the blogs.
Yes, so please, if you're interested in learning more about concussion, head to the head injuries in Pole blog that I've got up there. Yeah. Other myths about dizziness. The one about dizziness only happens when I spin too quickly.
Yeah. And that's a little bit what we spoke about before, going motion sensitivity. You are introducing a new skill that you're not used to. So your body's going to provide different responses. Like we were talking Superman, you get that initial pain response because your skin isn't conditioned to that particular grip. When you're doing spin pole, if you're doing it really, really quickly, or it's not something you've done before, you may get symptoms of dizziness as a result. So a couple of really key things there that can help when you're first trying spin is to take it slow. So the closer you are to the pole, the faster you're going to spin. Keep it nice and easy. Relax your eyes and make sure that you are focusing on a horizontal plane. So people who are ex-dancers are often taught to spot focus when they're doing their spin. So they'll have a particular point on the wall on the mirror, they'll do a spin, their head will come back to that. They'll do a spin, their head will come back to that. That doesn't quite work for pole, considering how fast we spin around the pole. So it might be something that you can check every now and again, just a quick visual if you're training where there's a mirror, going, yep, that's where I am, and keep going, but don't try to constantly do that. Another one is take a rest in between. If you haven't done spin pole before, it's like learning a new trick at pole. You're not going to be able to do it again and again and again and again in quick succession. Give your body a little bit of a break for it. And that's where learning spin through classes is really good, because there will be different aspects that are thrown into it. You may be doing some floor choreo, or you may be doing some choreo around the pole, even just simple body waves. You're not actually spinning with it. So you get it, your body gets a little bit of a chance to recover and adapt to it. And a really, really important one, and we spoke about the canals and how they've got fluid in the canals, spin in both directions. That way the fluid can move in both directions. Seems really silly, but it's actually really, 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 really important from a dizziness perspective. So it's not just your instructor going, you need to train both sides, which you should be doing anyway, but it actually helps with decreasing the likelihood that you're going to get some dizziness with it.
I love that one so much. So if you come down from a spin, you automatically feel dizzy, start spinning the other direction if you can, even if it's a basic spin. I love that tip so much because it works and it's just equalizing that endolymph fluid. I just think,
and you're having a look when the fluid's moving, it's moving the hair follicles at the same time, which is giving that awareness of, how your head's moving.
Yeah.
Like really.
It might be like a pencil spin and you're just spinning the other, or it might be a chair spin. So it might be for yourself, depending on your level, it might be an easier spin, or it could be we call it a fireman spin where your legs are over the pole. Yeah. It could be a simple spin, but because you're spinning in the opposite direction, it's just helping to equalize. I love that tip so much. Amazing.
And I think it really comes into, if you're noticing that your dizziness only happens when you move really, really quickly, it could be that you're, again, what we spoke about, just your body's not adapted to it, or it could be something else, which is when you need to seek health professional intervention.
Yeah, which is why we spent so long talking about all these other things that the viewers at home, they're probably thinking, I wasn't needing all of this information about the vestibular system at the start. But the reason why is because there's a lot to unpack when it comes to dizziness. So if we bring it back to pole dancing, 99% of the time, most of the reason why pole dancers feel dizziness when they're spinning on the pole, or not even, sometimes it's on the pole, but most of the time it's when they stop spinning, but they feel dizziness. Yeah. Most of the time it's benign. So it's usually because we're not used to spinning that fast, or we're just not used to spinning at all. And so progressive overload and adaptive strategies to build up your body's resistance to the effects of spin are what's going to be the most helpful in that situation. And so you can work with the physio if you need to for strategies to exposure to spin. But I think it's really important that we're so aware that it's not always a spinning pole related issue. It could actually be something more that's going on.
And I think actually another one that I didn't mention is something as simple as dehydration.
Yes.
And make you feel dizzy. So if you are doing a really, really hard session and you're not keeping your fluids up, or you're doing consecutive classes, you may actually be getting dizzy because you're dehydrated, or you haven't had enough food intake and energy intake. So again, there's heaps other aspects through there which we assume are more common for people, but aren't always.
Yeah. So we have a lovely blog on this one as well that I wrote a couple of years ago. I think it's a couple of years ago now. Oh, time is flying. So if anyone who wants to read that, it's called Spin Pole Sickness. So it's what to do when you're experiencing dizziness on the pole. And then I believe the concussion blog was head injuries in pole dance, I think is what it was called. But if you go to the Pole Physio website and you go to the blog section, there's a little magnifying glass that will be your search button. Click on there, type in type in spin pole sickness or head injuries, and it should come up. So either the concussion or the dizziness based blogs. Yeah. So key takeaway from today, what would you say?
I think the most important thing is don't ignore your dizziness. Don't simply put it down to my crystals are out. If you're learning spin pole for the first time, slow it down. Talk to the instructors. I can guarantee you every instructor that is an instructor, learned spin pole for the first time, has gone too fast, has probably had some symptoms of dizziness. So they'll be able to talk through some strategies with you. If it's not improving, go and see a health professional, because we will be able to ask all the questions, do the assessments to identify, well, where is your dizziness coming from? Is it purely just you're not conditioned to doing spin and we need to use some different strategies? Or is there something else going on that needs to be managed as well? And if we're not the right ones to manage it because it is a lot more advanced from a vestibular perspective, we know who to refer you on to so that you can get the right strategies to keep polling. Is the most important.
I love that take home. I was going to say, I love treating vestibular patients because we get up to some really fun exercises. We get to do
that's so
great stuff, getting like lasers out and lots of video watching stuff. And I really enjoy, particularly the triple PD patients, actually really interesting. I find great ones to treat.
The fun eye movements.
Yeah. So
okay.
Yeah. Look like one of those lucky cats.
Yes.
Cats? Those clots on the wall of the clocks. Anyway, we'll leave that one there. Everyone watching at home going, we have no idea what they're talking about. It's an in thing. It's a very in thing.
Sorry.
That's all good. Well, cheers to you for joining us for our second session. Thank you so much. I've very much so enjoyed chatting to you and drinking some tea. I've loved this for our cafe summer series. Thank you so much for your time. I'm looking forward to bringing Pole Physio world, the pole world, I should say, an aerial world, some more of these summer series. So for everyone who's joined us, keep an eye out on your emails because there'll be a couple more dropping shortly. But otherwise, we hope that you all train safe, take care of yourselves, and we'll see you at the next one. Bye.